My name is Kelly. I'll be your nurse practitioner today. How are you?
Good, thank you.
Great. So today we're going to be assessing your neurological, your GI, and your musculoskeletal system. Okay. I'm going to start out by asking you a series of questions. First, can you please state your full name and date of birth?
Renee Navas, 7/26/84.
Great. Immediately, can you tell me what day of the week you're in?
Thursday,
What city you're in?
New York.
Excellent. And what are we going to do?
An exam.
Excellent. Great. So immediately is a nerve oriented to person, place, time, and situation. Immediately we're gonna go ahead and start off with assessing your cranial nerve 1, which is your olfactory, okay? I'm gonna ask you to close your eyes and let me know when you first smell the scent, okay?
I smell
Great. Can you describe the scent for me?
it's like fruity.
Okay. And are you able to smell the scent on both ears? Good. So cranial nerve 1 is intact. Now we're going to move on to assessing cranial nerve 2, which is the optic nerve. This is done so by doing a vision acuity test. I'm going to show immediately to keep our glasses on, cover one eye, hold the chart out, and read the smallest line she's able to read fully.
LTFPH.
Okay, now the opposite eye.
LTFPH.
Good. So his eyes are 20/20 bilaterally with her glasses on. Immediately, I'm gonna go ahead and check for pupillary response. Alright. Just stare out. Flash in your eye. Okay. Opposite eye. Great. So Immediately's eyes were equal, round, reacted to light. Now immediately I'm going to ask you to follow my finger. Perfect. So no extraocular movements were noted. Central nerves 3, 4, and 6 are intact. Now immediately closing your eyes, we're gonna do a finger to nose point test. I'd like for you to again point to your nose while your eyes closed. Opposite side. Good. Excellent. So we was able to point to her nose. Now we're going to assess cranial nerve 7, which is for facial expressions. Can you please squint your eyes nice and tight, raise your eyebrows, purse your lips, and give me a nice big smile. Excellent. Okay, so cranial nerves 7 appear to be intact. Our facial expressions are symmetrical. Now we're going to move on to assessing cranial nerves 9, 10, and 12. Okay, so if you can, stick out your tongue, say ah. Excellent. Move the tongue side to side, up and down. Excellent. All right, and now can you give me a nice deep swallow? All right, so everything appears to be symmetrical. Uvula was able to raise up and it's midline. No lesions were noted. Now we're going to go ahead and move on to assess cranial nerve 5, which is success for facial sensation. Immediately, I'm going to ask you to close your eyes, and I'm going to brush a cotton ball along your face, 3 areas. Let me know when you're able to feel all the sensation, okay?
I feel it.
This is B1,
I feel it.
B2, now B3. Okay, so immediately was able to feel the sensation. I'm going to go ahead and continue down the body and let me know which side when and which side you're able to feel the sensation of the body, okay?
Right.
Left, left,
Right.
left, left.
Right. Right.
Okay, great. So immediately was able to feel the sensation all along her body and upper and lower extremities. Now we're going to move on to do a 2-point discrimination perception to touch test. Okay, so again, maintain your eyes closed and let me know if you feel 2 points or 1. Okay.
2. 1. 2. 1. 2.
sharp and dull test. Again, with your eyes closed, you're gonna let me know if you feel a dull or a sharp touch, okay?
Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull.
Great. Excellent. So we really was able to distinguish between sharp and dull. Perception and sensation seems appears to be all normal. Okay. I'm gonna go on to performing a mobility test, where I'm gonna brush gently underneath your feet to check for reflexes. Okay. Okay. Positive reflex. Excellent. So Media's toes curl upwards, which is a normal positive mobility test for an adult. Okay. Now I'm going to perform a test called stereogenesis test, where I place an object in your hands. You're gonna close your eyes and let me know if you could distinguish the objects in your hand. Okay.
Lock. Cotton ball. Great.
Excellent. Now, I'm gonna perform a test called the gravithesia test, where I'm gonna draw something on your hand, and you're gonna let me know if you're able to distinguish what the drawing is. Okay.
Letter B.
Good.
Number 2.
Perfect. Excellent. All right. So, cortical sensory functions are intact, which is all normal findings. Now I'm gonna go ahead to check for head and shoulder movements. Okay. Lily, can you please try to shrug your shoulders against resistance? Now, can you move your head left to right with resistance? Okay. All right. So, full range of motion was noted. Level 5 expected findings of range of motion. Period being intact, which is assessing for central nerve 11. Now, immediately, I'm going to perform a hearing test. Okay, this is to check for cranial nerve 8. The first test we're going to do is called the Wepner test. This is to distinguish between conductive versus sensory neural hearing loss. Okay. First, I'm going to start the tuning fork. I'm going to place it in your middle of your head, and you're going to let me know if you're able to hear the sound on both ears equally, or do you hear one side over the other. Okay. Oh, okay, great. Now I'm going to move on and perform a test called the Ryan test. This is to check bone conduction versus air conduction. Now, a normal Ryan test, the patient would hear the air conduction longer than the bone conduction. Okay, so again, I'm going to strike the tuning fork. I'm going to place it behind your ear in the mastering process, and you're going to let me know when you no longer hear the sound. Okay. Stop. Okay, now I'm going to place the lateral to your ear. Still hear it? Great. All right. I'm going to perform the same test on the opposite ear, the left side. Again, striking the tuning fork. Let me know when you no longer hear the sound when it's placed on your mastering process.
Stop.
Okay. Are you still able to hear the sound?
Oh, yeah.
Yes. Okay, so no hearing loss was noted, which is great. Since cranial nerve 8 is intact, now I'm gonna perform a test. While I still have the tuning fork, I'm gonna check the vibration test to see if you're able to feel the vibration of your fingers. Okay, so extend your hands out and again strike the tuning fork. Let me know if you're able to feel the vibration. Okay.
Mm-hmm.
Okay. to hear it?
Yeah.
Feel
No,
it?
I
Excuse
don't.
me. Do you feel
Sorry.
it? Okay, no. All right. Again, opposite hands. Do you feel the vibration?
Mm-hmm.
Do you feel the vibration?
No.
Okay, good. All right. Now, I'm going to ask you to see if you can swipe your shin with your heels. This is a coordination. Good, okay. Now, can you, we're going to perform a test called the Romberg test, okay? I'm going to ask you to stand up, close your eyes. I'm checking for any swaying, which I don't see. Okay, can you hop up and down for me? Okay, good. And now I'm going to ask for you to walk back on your tippy toes. Okay, and can you walk back towards me on your heels? Excellent. So, this coordination is good. Her strides are symmetric and even. No issues there. Now, immediately, you can sit down. We're gonna go ahead and move on to assessing your musculoskeletal system. Okay. I'm gonna check for deep tendon reflexes. By lightly striking me with this hammer in a few different areas. Again, I'm assessing for deep tendon reflex, okay? First, I'm going to start off by checking your biceps, okay? Reflex noted. Now your triceps, okay? Reflex was noted there. Brachioradialis, okay? Perfect. So I'll twist there. Now we're going to go on and assess her left side of her biceps. Okay, there you see a reflex. Now her left tricep, the reflex was noted there. Now her brachial radius, her thumb curl inwards, which is a normal reflex. Now I'm going to go ahead and assess her lower extremities. The reflexes in her lower extremities, starting with her knee to patella. Okay, there's a reflex there. Reflex there. Now I'm going to strike her behind her foot and the Achilles. Okay, reflex is loaded there. Opposite side, loaded there. Okay, perfect. Now we're going to move on and check the muscles. Okay. I'm just inspecting the muscles. Can you yes, extend your arms? I'm gonna press down. You're gonna try to resist. Okay. All right. So now opposite direction. Just press down on my hands. Now I'm gonna assess for her lower extremities. I'm gonna press down. Try to resist. Good. I'm gonna press up. Try to resist. Good. Good strength. Excellent, Gary. Now we're gonna go ahead and move on and check your GI system. Okay, great. So if you can, you can lay down, make yourself comfortable. All right. First off, I'm gonna just inspect. I'm looking for any striae, which I don't see. Abdomen is flat, no visible masses, which is good. Now I'm gonna go ahead and auscultate. Listen to for 4 quadrants. Vowel sounds were present in all 4 quadrants. Sounds are normal reactive, which is all good signs. Now I'm going to go ahead and listen out for her aorta, which is in the center here. Okay. I'm going to move on to checking her renal arteries. Her iliac arteries. Voice heard. Everything sounds normal. Okay. I'm gonna go ahead and start percussing, starting on the right upper quadrant. I'm gonna percuss her liver, check for her liver span. Okay, liver is dull. It became tympanic down here, about 6 centimeters was the liver span. I'm gonna go now ahead and assess the left side for her spleen. Okay. Same thing. So the spleen span was about 6 centimeters. It became tympanic right down here. Um, Now I'm gonna go ahead and feel, palpate first her aorta, okay, which is midline. Any pain, discomfort? No. Now I'm gonna go ahead and palpate and check for cholecystitis. Okay, let me know if you feel any pain, okay? Any pain? No. Now I'm gonna go ahead and palpate her lower right abdomen. This is to check for appendicitis, okay? Let me know if you feel any pain. No? Okay, good. I'm gonna go ahead and do a test called the perform obturator test, where I flex your right leg and move it outwards, okay? Let me know if you feel any pain. Any pain? No? Good. Okay. Now I'm going to assess your kidneys further. Okay. Just help me right here. Let me know. Any pain, discomfort? No, so no kidney stones present. Um, okay. Do you have any questions or concerns? All right. Well, thank you so much for participating. That concludes our assessment.